Hi, everyone. We are pleased to welcome you all to this recorded Q&A session on the My Health Record in Specialist Practice, how to save your practice time and improve patient outcomes. My name is Rithi, and I'm the Digital Health Officer at Adelaide PHN. And joining me remotely is Kathy Rainbird, all the way from Brisbane. She is the Manager of Education Partnerships and Education Policy Programs and Engagement at the Australian Digital Health Agency. Unlike the other My Health Recorded sessions, this is a purely Q&A session, and it'll have just FAQs being answered by Kathy. And these are the FAQs that we've identified over the years that are common to most specialists. And Kathy has taken out her precious time to join us and answer all of them. So I'll first begin with the acknowledgement of country before we head straight into the subject. So I would like to acknowledge the traditional owners of the country throughout Australia and their continuing connection to land, sea, and community. We pay our respects to them and their cultures and to elders both past and present. Well, before we begin, I'd just like to do a bit of a housekeeping, just to apologize that if you hear any background noises, kindly ignore. And thank you so much for your cooperation. All right, so Kathy, should we begin?
Sure.
Perfect. So I'll just flick the first question to you, and that is, a lot of our specialists currently use the My Health Record. Can you briefly tell us what documents can be added to My Health Record and possibly elaborate a bit on uploading specialist letters?
Yeah, thanks, Rithi. So yes, specialists in particular have been a key priority group for the Australian Digital Health Agency for the last year or so. And the things that can be uploaded from a specialist end tend to be the specialist letters, and having that key crucial information available for others to be able to see is an immediate win in terms of providing better continuity of care for patients. It means that that crucial information is wherever the person goes across the healthcare system, it travels with them and it's available. So those specialist letters are invaluable. The other document that specialists could potentially upload might be an event summary, which is about a single specific item perhaps in My Health Record. So it might be a medication that a person is taking, or it might be around a specific allergy or a delabeling of an allergy if you're a specialist in that space, and so on. So adding those in a coded way can make sure that that information is visible in other parts of My Health Record when people access it elsewhere. So there's a couple of things that can be uploaded, but the main one is those specialist letters.
Perfect. Thank you so much for that. Sorry for disabling my video, just so you could focus on what Kathy's saying and not my bobbing head. All right, so that takes us to our next question, and that is, how has the MHR specialist landscape changed over the years in terms of statistics, and how there's a change in uptake? Is there a change in perception? Can you just elaborate on that? Thank you.
Yeah, thanks, Rithi. I think there definitely has been a shift as more healthcare providers are utilising the system. I've got some stats in some slides in here, which I'll just go through quickly. These are the sort of types of documents that can be uploaded into the system and found within the system. And I think in there you'll see that that's those specialist letters and event summaries I just mentioned. But there's a whole raft of other information that clinicians can find. And I think as more specialists are understanding what can be found and how much time that can save their practice, they're realizing that having access to My Health Record is a real win for their practice as well as providing that information across the healthcare system. In terms of the statistics that we have, in terms of the general population of people having My Health Records, 23.6 million Australians have a My Health Record existing at the moment, and that's been steadily increasing, but more importantly, 98% of those records actually have data in them. When it first started out, My Health Record was generally fairly empty until someone interacted with the healthcare system. So for instance, your own My Health Record might be quite bare until you go and have a particular procedure done, or you go and have an immunization, or so on, and something gets uploaded. And as that happens, then the information builds up over time. So more and more content is coming into the system, and I think that that's then reflecting in terms of the clinical potential and the clinical benefit of using the system and getting connected and actually accessing the information. In fact, we hit 1 billion documents as of June this year. 1 billion documents have been uploaded into the system. So there's a raft of information now accessible through My Health Record. And you can see on this slide, we've got over 413 million clinical documents, which can be a bit overwhelming and daunting, but we also are working on making the information consolidated and bringing it together in ways that makes it easier for clinicians to find the key bits of information they need, in particular, medicines information, immunization information, hospital discharges and so on, and pathology reports, diagnostic imaging, which some of you may have heard is going to shift in the near future to be default to send. So all of the pathology labs and all of the diagnostic imaging services will be uploading their reports, unless of course a patient asks them specifically not to.
Perfect. I think the first word that comes to my mind is wow, because of the sheer amount of the volume of data that's been uploaded, and also because you've said that now the pathology reports will directly come into people's accounts. So it's amazing how MHR has changed and how it's been steadily being embedded into the healthcare system, which is great, amazing. That brings us to our next question, and it is a scenario-based question. So say if I were a user of My Health Record, I would be interested to know about authorizations around viewing and uploading patients' information. Can you tell us a bit about that?
Yeah, sure. I think I have another slide on that. Let me skip ahead to the relevant slide. There is specific legislation that actually covers the use of My Health Record as a healthcare provider. So providers who have a legitimate reason to use the system, as in you're providing care to that person, healthcare to that person, are authorised to do so under the legislation. So that means you do not have to specifically ask a patient before you look at their My Health Record. You don't have to ask for their permission to upload into their record or to look at their information. You are authorised by law under the Act to you have the authority to view and to upload, with a few exceptions and a few provisos. So the authority to view is as long as your organisation is actually registered. So that would be your practice has to be registered to connect to the system, and you are providing healthcare to that patient. So you're not viewing for the purposes of insurance or employment assessment or so on. In terms of uploading, you again are authorised to upload, so for instance, your specialist letter, without having to ask the patient specifically. If a patient does say that they explicitly don't want information uploaded to their record, then you do need to make sure you comply with that request. So they're the exceptions. If someone says, please don't add this to my record, you need to make sure you uncheck the box which lets you upload. There's a clause also relating to uploading of shared health summaries. That's generally done by the person's main regular healthcare provider. So there might be some specialists who would fall into that space. And if you do, then if you're uploading a shared health summary for that patient, then you need to have a verbal agreement with the patient that you are that main provider. And where there's state and territory laws that apply in terms of requiring consent around sensitive health information, then you still need to abide by those laws. So, but otherwise, it's there to be used, and it's there to support better care for your patients and give you access to key information when you need it. So I encourage you all to have a look and start using.
That's absolutely fantastic, Kathy. I really like how you explained the interplay of being able to use it without being worried about whether they can use it, but also at the same time take care of any cybersecurity issues and consent and stuff like that. So it's a good balance, I feel. So thank you for that. And our next question now. So it brings us to the very pertinent question around how patient-centric is my health record and how they can control who views the documents and add any new documents.
So as I mentioned, with that authority to upload, then that means that if a person has a My Health record, it's generally there to support better healthcare for them. And you do have that authority to add information into their record. If it was something particularly sensitive and you weren't covered by one of those consent laws, then it would still be worthwhile having the discussion with the person and saying, oh, I think it would be good to have this available for other healthcare providers to see. It's just polite and good practice to perhaps have that discussion with the patient. But in terms of patient controls, there are other things that if any person has any concerns about privacy, they can put over their My Health record. So as an individual, you can make the choice. First of all, you can choose whether or not to have a My Health record at all. Although, as I pointed out earlier, more and more people have actually been choosing to have one, even though they may have opted out originally. But if you have got one and it's generally open access, if you wanted to lock it down further, there are a couple of things you can do. One is that the individual can put an access code over their entire record. So then only healthcare providers that they give that code to are able to access the information. That's called a record access code. So if you come across a patient and you click on the My Health record button and they have that code in place, it'll come up with the little pop-ups prompting you to ask the person for that code. They tell you the code, you put it in, and then you're into their My Health record as per usual, if they're happy for you to look at it. The other scenario is where a patient chooses to lock down a specific document and they can put a code over just a single document. So if they had, say, some sensitive information around a mental health condition, for instance, they might feel that they want to keep that more private and have it only accessible to a limited number of the clinicians or healthcare providers involved in their care. And in that case, they would put an access code just over that document. And then only organisations that the person says can actually open and look at those documents. If those codes are put in place, then there is a provision for an emergency break glass if it is an emergency situation and the patient isn't able to actually provide that access code or give that option to be able to open it. So there is that facility, but it's only to be used in specific exceptional circumstances. So it's not to just be clicked on if someone's forgotten their code. The other thing in terms of patient control to be aware of is that patients can choose to receive an SMS or email alert when an organisation has access to My Health record. So as I said before, you as a clinician have the authority to look at a person's My Health record, and you don't have to be doing it while you're in the consultation with the patient. You can do it before they come in to see you, but they could get a ping on their phone to say, oh, Dr. Rainbird's just opened your My Health record, and they might be going, oh, well, that's good because I've got an appointment with her this afternoon, so I'm very happy for her to have checked my Health record. The other thing to note is that we do have a cybersecurity team here at the agency that monitors the use of the system, not the contents within it, but the access and the appropriate access controls that are behind the system. So just be aware that that can be monitored and audited and checked. For instance, if there is an emergency access break glass use, that will generally be followed up to confirm that it was for a legitimate purpose. So things like that are happening in the back end as well to keep the information within the system safe and secure. We also have security requirements that the software vendors who connect to My Health record have to go through, and that's quite extensive as well, which may be why some software products that you work with aren't yet connected up to the system, but a lot of the specialist softwares have now connected, which is fantastic, and enabled that ease of workflow to upload your specialist letters. Thanks, Rudy.
Thanks, Kathy, for that very comprehensive, detailed information. And the other thing I wanted to say is I like the sound of Dr. Rainbird, perhaps for this session. Yeah. All right. That brings us to our next question that is again scenario-based. In case of patient emergency like a fall or accident, if a patient has put an access code over their My Health record, what steps can be taken to ensure immediate patient care?
Yeah, so that's partly what I touched on around that emergency break glass function, but I think I've got a slide that specifies the actual when it can be specifically used. So again, this only applies if a person has put those access codes in place. So in most instances, people have an open My Health record for healthcare provision, and you are have allowed to go and look at it. But if they have a code in place and there is a serious reason why you need to access it, then you can use that emergency access or break glass. And there's usually an option within your software. There's either put the code in, or I don't have the code, emergency, I need emergency access. And these are the specific instances where it is permitted to access using that emergency access provision. So it's when you, as a healthcare provider, reasonably believe that there's a serious threat to the life, health, and safety of the individual, and it's unreasonable or impractical to obtain consent of the patient to be able to actually get their access code and get in through that way. Or it's you believe that it's needed in order to prevent or lessen a serious threat to public health or safety. And again, it's unreasonable or impractical for you to get that consent from the patient. They're the only times it should be used. And the other thing to mention is if you do use that emergency access, do make a note in your patient's note as to the reason why you did that, because as I said, it may be followed up and you may be needed to provide a response to the agency around why that emergency access was used.
Perfect. Thank you, Kathy. Now, our next question is, given that MHR interacts with practice softwares, can you tell us how do they interact with each other, and does it affect patient data?
It's interesting because while the My Health record has integrated, or a lot of the software products have worked to make it integrate into your product so you can click a button and get into a person's My Health record, that information from a person's My Health record is actually stored separately from your clinical software. So if you want to keep a specific document, there's usually a way that you can download and save a copy of that document, but you're actually accessing it through the person's My Health record when you're clicking on that My Health record button and viewing it that way. So while there is interaction in terms of that access and that ability to upload your documents as well, it is quite separated. However, it's really important for you to think about your local systems and making sure that the information that you're putting into your local systems is accurate and up to date and coded so that that information then can be transferred in that structured way through into the My Health record system. The other thing to be aware about in any clinical practice is your cybersecurity. Thinking about your local systems and how cyber secure they are, because that will impact in terms of how well it protects the system from your end. We do all the work we can at the agency end to keep the information safe and secure. We have lots of requirements in place to keep that secure. But it is also important for your local systems to be secure, and that's by building your cyber resilience of your team, your processes, and your technology. So these are just some questions to think about and to perhaps put to your practice manager or think about as a team. And if you need resources, have a look at the webpage that's listed on the bottom, cyber.gov.au, and that takes you to this Australian Cybersecurity Centre and gives you really good tips for businesses and keeping information secure and safe in our digital health world.
Yep, and I think, Kathy, that leads us to very well into our last question, and that is, any resources that ADHA offers for specialists? Yeah,
we've got a whole lot of different resources. There's one specifically that relates to cybersecurity. So we've actually got a digital health security awareness e-learning module, which can be accessed through this website here, training.digitalhealth.gov.au. That also takes you to our whole page of different resources, not only for specialists, but all sorts of different healthcare provider groups, as well as consumers, so individuals. So if you have someone who's asking you questions about My Health record, you can also point them to the resources that are for everyone. There is some specific resources on this slide, which we'll share after or make available, with links to if your practice isn't yet connected to My Health Record and the things that you need to think about. All of these links take you to the relevant parts of our website, which provide guidance and further information. And this is where you can learn more about how to stay up to date with digital health through our e-learning modules, our webinars and events, software summary sheets, and so on.
Amazing. Thank you so much, Kathy. And that brings us to the end of our presentation, of our recording. And thank you guys for tuning in, for listening to this recording. If you've got any queries, please feel free to reach out to the Adelaide PHN Digital Health team at digitalhealthinfo@adelaidepHN.com.au. It should be in the captions below the video, hopefully. And yeah, thank you so much for your time again, Kathy. And I wish you well in Brisbane.
Thanks, Riti.
Thank you, guys. See you. Bye.